coming to a boiling point right now, and it's a very painful moment. So I want to acknowledge that. We're here to talk right now about one aspect of the systematic inequality that we have, which is our healthcare system and our healthcare coverage. Yesterday, I had the pleasure of speaking with Mary Garish, who is a human rights lawyer and who works with the UN and got, has been fighting for a long time for this. She wanted to join us tonight, but she had a conflict. So that is going to be a podcast that comes out tomorrow. But, you know, she really pointed out that healthcare is a human right. It's actually a codified human right in international law. And every other comparable democracy that has the types, you know, anywhere close to the resources we have, has universal and single payer healthcare, or, you know, has healthcare coverage for their people, and we don't. And we're going to talk a little bit about that, about where we are now, where we want to go, and most specifically the New York Health Act, because it's becoming pretty apparent that we're not going to be able to get a federal plan passed, given the candidates that we have. So it's going to fall on us here in New York to do it. We have an excellent plan to do that. We have the ability to do that. So we're going to be talking to some amazing panelists about all of this. So I'm going to start actually with Dr. Soboroff. Susan Soboroff, who has been practicing, was practicing as a doctor in Trumansburg for 28 years, and she worked at the Ithaca Free Clinic for 10 years, and has been an amazing advocate for, actually before I start, I should say this. Participation on this panel is not about politics. It's not an endorsement of me or anything. People are coming out to talk about, and so we could all get educated about a topic that I think is very important. So Dr. Soboroff has been an amazing activist for the New York Health Act and for healthcare in general. So Dr. Soboroff, can you tell us what is the New York Health Act?
Sure. Thanks for inviting me, Sujata. I'd love to talk about the New York Health Act. Certainly, we'll be saying a lot tonight how the pandemic has brought to light the failings and the injustices of our present system. And we feel that a single payer program is the only way to bring universal health care, which is also shown, you know, we've seen how incredibly important that is now, right now, in a way that's affordable, that's sustainable, and that will make all of us healthier. The numbers of people in this country that have come down with the virus, the disparities in the deaths due to the virus, as well as due to police, and the other disparities in our social system has made a public health crisis emergency emerge, and a universal plan's the only way to do it. So the New York Health Act is a very good single payer plan. It provides for a publicly funded and publicly administered health insurance program that will cover every resident of New York State. And that means that health insurance won't be connected to a person's job or their age or their state of health or their finances or their state of documentation. Womb to tomb is how we say it. The coverage is also comprehensive. It means a platinum plan for everybody. It's everything that the New York State insurance laws have mandated, as well as what Medicare covers now. And in addition to that, it will cover dental care, vision, hearing, and long-term care as well, with an emphasis on long-term care in the community. and we can thank the disability activists for pushing for that. The private insurance with its wasteful, profit-driven overheads will be eliminated from and not allowed to cover services that the New York Health Act covers. And that's where much of the savings comes from. And that also means that there are no deductibles, no copays, no premiums, regressive premiums, and no narrow provider networks. But that gets, of course, to, well, you know, how are we going to pay for it? Well, the New York Health Act is a self-financing bill, which means that it provides for its own funds. And those come from federal funds that New Yorkers are eligible for, like Medicare, Medicaid, CHIP. And it comes from a progressively graduated payroll tax that's contributed by both employers and employees, as well as the same tax on non-payroll income like dividends and capital gains and rent. And this is very comparable to our Social Security tax. The bill also provides for care coordinators that will help people navigate through the system, and for accountability by way of a representative board. So the bill includes a lot of good details. It's simple, it's affordable, and it's shown by study after study. Most recently, a very conservative Iran study that showed that it will save money for 90%, if not more, of New York residents, and that it will continue to save money for all of us in the long run as people get healthier. And we can talk.
You want to tell us who those 90% are? I mean, who are the 10% who it won't save money for?
Well, that's according to the RAND study, that there are 10%. If you look at Gerald Friedman's study, it's only 2%. But it is the wealthiest people in this country. So it means having a graduated payroll tax means that people pay what they can afford to pay. And so the wealthiest people in this in the state, particularly, and New York is a wealthy state, will be paying the most. And some of those folks will be paying more than what they pay now. But the vast majority of residents of New York will be paying less. And so for some people, none, because what we'd like to include in the bill is for folks who make up to at least $25,000, maybe as high as $50,000, not to have to pay any tax at all. Yeah. So, and that remains to be seen whether we can make that happen. But it's comprehensive, and most importantly, it means that we have a plan that's universal, that covers everybody, and that will lead to all of us being healthier, the economy being healthier, our businesses being healthier. So I'll leave it at that. And
I think this is so important, and we have gotten pretty close with this. What got we've passed this in the Assembly several years in a row, and it's in the Senate where we've only got a very small number of votes we really need to turn to get this to pass. So I want to, and I'll be going back, and you guys can jump in as you want, but I wanted to turn it over to Mirabel Teneo, who is very active with the Campaign for New York Health. She's been on the ground, working hard at grassroots organizing. She has a background, 30 years in education and administration in the New York City School District and as a community organizer. And I wanted to ask you, number one, what are you guys doing now to kind of build momentum to pass this act right now? And also what brought you to this work out of the work you had been doing? Oh, you're muted, Maribel. Maribel.
So sorry. So in terms of the work that I'm directly participating in,
You've frozen. We might need to actually listen.
With Ursula Rosen out of Syracuse, and
just a minute, we're having technical difficulties. Maribel, can you try shutting off your screen, because then we'll hear your audio better, because it sounds like the connection is causing a.
Got it. Okay, is that better?
Good, very good. Yeah, thank you.
Okay, great. So in terms of the work, I've been working with Ursula Rosen out of Syracuse, and we've been collecting personal healthcare stories that can then be shared with legislators to pressure them around the New York Health Act, as well as COVID stories. Susan, am I okay?
You're okay now.
Susan,
I'm afraid you're cutting out again. Oh no, I could hear you so well.
A basic fact about this country, which is that we have Do you want to come back to me?
I'm going to come back to you. I'm wondering, we could try a Zoom call. Stephen could send you an email maybe with a call-in number, and that might be a way that if the internet connection isn't that great, that might work. Stephen, would you be able to send do you have her email? Could you send her a call? So she did stop video. Okay, well, we're going to come back because what you have to say is so important. And I really want to hear all of it. But while we're waiting for that, I would love to turn the floor over to Scott Marshland, who is on the front lines right now, working at Upstate Medical in the ER department as a nurse, and also has a long history working for healthcare reform. Scott, I understand that you actually are one of the original founders of the Ithaca Free Clinic, which I really want to thank you for, because for many years that was my only insurance, or my only source of healthcare. So I was very, it's really an honor to have you here. So I would love to ask you to talk about really any aspect of this, and why you had to start the Ithaca Free Clinic, what you're seeing at Upstate, what are the problems in the healthcare system that we need to address, and if you know how the New York Health Act might be able to solve some of that.
Right. The Ithaca Free Clinic originally began with the Ithaca Health Alliance, right? And radicals that have since left Ithaca, like Paul Glover, who started Ithaca Hours. And the New York State Insurance Department was giving a hard time to the Ithaca Health Alliance for a period of years, questioning their status. And the formation of the Free Clinic, the financial impetus came from the Ithaca Health Alliance as a way to maneuver around that situation. I'm thinking about this group, there's smart minds that have many things to say here. I was trying to think, what's the most important thing I want to communicate? I feel like the most important thing I want to say is that in terms of having universal health care for people in the United States, we need to look out to each other and not up for leadership on this matter. I'm appreciative of the deep level of commitment and compassion on the part of physicians like Susan, Justine Waldman Schaff, who was co-chair of the Free Clinic Committee when we started it, and helped start the REACH Clinic in Ithaca. But part of what my perspective as a nurse is, also as a nurse that's a labor organizer and tried to help start a union here in Ithaca at the Hugo Medical Center, is that sadly many physicians in the United States leave medical school with a soul-crushing amount of debt. And you could say that people who are deeply indebted are not free to make rational and courageous choices. And so I think that for many years, Americans have looked to our esteemed physicians for leadership on this issue. And I would say that we need to not do that. We need to look to each other. And I say that not out of any disrespect or disregard for my esteemed physician colleagues, but just as a acknowledgement of the realistic rubber on the road that, during our union struggle at Hugo Medical Center, I was heartbroken that really the only physician that gave us support in that struggle was Dr. Kilgore, who's a well-known vocal critic within Ithaca. And also that physicians in the United States, the American Medical Association has been opposed to nationalized healthcare for more than 100 years. Mm-hmm. So let us look to each other for leadership on this. And then what I would add to that is that on the front lines, working as a trauma nurse, literally looking at the color of the skin of the people whose bodies I care for that have bullet wounds and knife wounds and chronic illnesses that are people who are coming to the emergency setting too late because they are uninsured or underinsured. Anecdotally, for more than 20 years, it's been very clear to me that the racism in our country, which is institutionalized, has very real consequences for Black and brown people and poor and working white people in this country. What I'm hopeful about at this moment of the pandemic is that more people who, for whatever reason, had the privilege of having insurance in this country, and maybe some of them are losing it, will come to understand more deeply that our fates are all tied together, and that failing to have universal coverage will result in pockets of contagion and the persistence of a virus in this country, which will, for many years to come, prevent us from eradicating this virus or fighting the next virus in line. It'll prevent us from ever becoming a society like New Zealand, which has pretty much snuffed out the virus. So in summary, in case this is the last moment I get to talk during this discussion, just to say, my beloved physicians are our allies, but they are not leading the way, and I don't think they will. And we don't need to look to them. We need to look to each other. And we're at a crossroads where we need to become well-versed in conversing with our neighbors, our friends, our colleagues about how our fate is tied together here. Mm-hmm. And New York State is in a position to lead around this with the New York Health Plan.
Yeah,
that's what I have to say.
I had a question for you as a union member. One of the things that I've heard from a lot of union members that I've worked with, and the issue that I saw when I was union organizing for many years was a lot of times people aren't, even if you're able to have an effective negotiation, all of the raise goes into the healthcare premium because it rises every year. Has that been your experience, or have you?
So just as a matter of transparency, I became a member of a union 4 years ago. So despite my organizing history, I'm a relatively new member of a union. I don't think that has been the case for me and my fellow members of the Public Employees Federation, which represents New York State employees. But what is very clear, the writing on the wall, if we look to our Western Coast union brothers and sisters, the governor of New York will be a couple steps behind the governor of California in asking for 10% or greater reductions in salaries, and all other benefits for state employees. And so they go, so goes the state, right? So short answer to your question, no.
That's good perspective. And Maribel, are you back? Did I see you back with us?
Can you hear me better now?
Yes.
I moved to a place and it looks like I have better internet service here.
Wonderful. So just for a recap, Maribel is, she has 30 years in education in the New York City or downstate system, and I'll let you talk more about that. But she's been an educator, principal, assistant principal, and a community organizer. And now you're organizing for the New York Health Act. So just wanted to hear about, why you jumped into this fight, how you're doing it, and kind of your thoughts.
Thank you. So very quickly, as I said before, I'm in the middle of collecting personal healthcare stories as well as COVID stories that we can share with legislators to pressure them to pass the New York Health Act. And in addition to that, which I think is a lot more fun, is we're in an ongoing manner hosting New York Health Act parties and rallies where we actually come together and collectively use social media at the same time to blast politicians and really put the New York Health Act in everybody's radars. So I'll be sharing resources and toolkits at the end, and if people want to reach out and they want to do their own New York Health Party, that would be amazing. But Susan, in a very detailed manner, laid out the huge mismatch between our national consensus that healthcare is a human right, yet we have a patchwork system full of holes that really doesn't live up to that ideal, right? That it's a human right. And so we have a situation where, a recent study shows that 50% of New Yorkers either skipped or delayed care because of cost. Now, I've been one of those people in the past, and the U.S. spends more than twice the next country that spends the most on healthcare, and yet our access and outcomes are worse. So clearly, there's a huge mismatch that we need to reckon with and take action upon. So obviously, that's big reason that I'm committed to single-payer universal healthcare and the piece about that it's for everyone. But I actually want to focus on some of the benefits to universal healthcare that are not related to health per se, but I think are just as important. So, for example, one of the outcomes I think of having a single-payer universal healthcare program is that it increases economic freedom for workers, so that workers actually can have greater freedom to change jobs that because they no longer have to be attached to a job because of health insurance. They can leave exploitative, abusive situations because they're not afraid of losing that health insurance. So I think that is a huge additional benefit to having universal health care, in addition to really providing families quality of life beyond the health benefits, so that families don't have to be separated because, I can't leave this job in this state because we need to have health insurance, so we're going to be separated for 6 months or a year. So I really do think that the benefits for workers and families in terms of quality of life and just personal and economic freedom are enhanced by having a universal healthcare program. I think additionally for workers As you know, for the past 4 or 5 decades, workers have been under attack. And I think having a single payer universal healthcare program will allow them to have greater leverage at the negotiating table with employers. If you remember last year, General Motors basically threatened the strikers with taking away their health insurance in order to pressure them to stop striking, right? So with guaranteed health care, now you're democratizing the work setting. And so I think that, to me, that's huge. It's huge when you democratize a work setting so that workers now have greater leverage, and now their voices can be stronger and better heard in their fights for better wages, for better benefits, et cetera, et cetera, et cetera. And I think, yes, I think finally, and I think this is a huge piece for me that I even connect to the recent police killings, and that is that I think America is exceptional in its, not only in its failure to develop social protections for people, vis-a-vis social democratic programs. I think it's also exceptional in its excessive punitive in response to the consequences for those lack of social protections. And so what I see is that communities that are most vulnerable, that have the least social protections, as Scott alluded to before, poor white communities, Black and brown communities, marginalized communities, these are the communities that most see the punitive arms of the state vis-a-vis over-policing and mass incarceration. And so you have these cities and states that have crippled budgets that don't have the programs that are necessary to support people's livelihood, and then they're getting punished. And so for me, the choice to support single-payer healthcare is the choice, an alternative path to excessive punitiveness, which characterizes America's response to negligent social policy. So I think for me, it's not, the health benefits are there, but beyond that, what it does to democratize our society and to boost workers and working people and poor people and marginalized people is just incredible. And I think I appreciate that Sujatha is committed to the New York Health Act, because I think the benefits will be well beyond health benefits. And I agree with Sujatha that because there is a very possibility that we will not have Medicare for all at the federal level with a Biden or a Trump, that New York has to step up and be a leader, with having a huge population, having a central economic role in the nation. I think New York is a great place to start this battle.
Yeah. I mean, and I love what the Campaign for New York Health is doing. That's why I've been getting involved in as many aspects of the rallies and organizing things for that, because I really think the only way we're going to pass this is if we all get out there and tell our stories, talk about what it is like not to have healthcare or to be underinsured, or how this is impacting us. And if we all get out there onto the streets and tell these compelling stories, I think we can do it next year. One of the things that you just said that really resonates with me is the impacts on so many other things. Like, I work with indigent defendants in the criminal justice system, and so many people that are put in jail really just need mental health treatment. Like, that is the go-to of people. Just, I've seen people put in jail, one guy for stealing a sandwich from Wegmans, and he was put in jail because no one knew how to deal with him because he needed mental health treatment. And it was just the most heartbreaking, infuriating thing, because by the time they called me in as assigned counsel, he'd already been in there for 5 days. you know, and this is just, it's just untenable because the trauma for someone, especially with mental health challenges, to be in jail is really extreme. And it happens every day, not just here, but across the state. So you know, and of course on workers and the freedom to be able to pursue things. So many people are working in jobs that don't pay them enough, that don't respect them enough, that they don't want to be doing because they need that healthcare. So thank you for your work, and I look forward to joining you in this fight, inside and outside of that building, and getting people out in the streets. And I'd love to follow up with some more stories from that. But I wanted to turn to Dr. Katz first, just so that we can hear from everybody, because Dr. Katz is a, let me make sure I get it, is a board certified chiropractic orthopedist. I just put aside my note of how to say it, but he has a lot of qualifications basically. And he has been practicing, he was practicing for years in Virginia, where he was able to take insurance, and where a lot more was recognized, and he had a lot more ability to treat patients. And then in New York, you know, he's really seen the shortcomings of how we do things here. So I wanted to ask you, Dr. Katz, you know, what is the difference? Why is it so much harder to, you know, what has been the challenge as a doctor of chiropractic to take insurance here in New York, and could a single payer health act help that? And, you know, what are kind of some of the other ways that we could help alternative practitioners really be more accessible to everyone and not just those with more money?
Yeah, thank you, Sujata. Also, since I also enjoyed having the opportunity also to hear from you, Scott and Susan, about the free clinic, and want to thank you. I've been volunteering there for 4 years, and I really appreciate all your hard work and service to people. And yeah, I've been in practice for 34 years, 28 years in Virginia, as you said, where I took insurance. Oftentimes when people call on the phone, that's their first question: do you take my insurance? And people often then hoping, expecting that it'll pay in full. And I had a staff of 6 people, and I had a full-time person dealing with insurance companies as a full-time job, which is getting increasingly difficult when you have a small office and a single practitioner. I was one of the first offices to have a computer in Virginia, you know, so it goes back to 1986, filling out all those forms. And one of the things on a website, when I was reading about the New York Healthcare Act, it talked about the acronym PIST, Private Insurance Stress Disorder. And I suffered greatly from that, as I know others of you have too. It's been extremely frustrating, and about having to deal with different regulations, keeping up changes in different regulations with private insurance. And I was also working with personal injury, going to court, dealing with attorneys, workers' compensation, the Medicare, the required documentation, and the ability to, to be able to adequately review claims on behalf of patients and being their advocate. I had some people who sort of enjoyed fighting for every dollar to try to get back from that insurance company to pay what they were, more contracted to pay. And to quite frankly put it, I've been in seminars where there has been still an underlying discrimination against chiropractic, and I've seen panels of people who have been claims processors for Blue Cross being told that they were just supposed to reject like every 5th claim indiscriminately, and that was their job. Who admitted that, who later quit working for insurance companies. So we have a lot of fraud, as well as a huge amount of waste, and that drives up the healthcare costs for all of us, in the field incredibly. And so for myself, when periods like this recession hit, when money was tight for a private office, all of a sudden I had a staff of 6 and an overhead of $25,000 a month, and I was losing money every month. And it became more of the people who could come. The majority of them were more of emergency care, where they were about to lose their job, go on disability. Nothing else worked, and most of them couldn't afford care. And I wrote off thousands of dollars of care. And my decision coming here, I'd rather work in the free clinic and give it away. I know I'm doing that, than having people break their agreements, go from doctor to doctor, running up bills to try to get care. And yeah, it's just been, and I, where I practiced in Central Virginia was a low income, the majority of population. And already there was even a high level of illiteracy there for people. And we had to do a lot of, part of the healthcare, a lot of it was really trying to educate people on prevention and wellness care. And one of the things, that I really would like to see, is more of a provision for chiropractic care, who to really be able to do the job that we've really been leaders in wellness and prevention for over 100 years. And to be, if we are going to be limited to what Medicare gives as a federal program, that's injustice to the current chiropractic patients.
What does
So
Medicare
I
cover?
strongly believe that there's, what does it cover?
Yeah, well, how much does it pay out on a, you were telling me the other day some of this, and it was really pretty shocking what will be covered and what's not.
Right. Well, what happened, when, chiropractors, we've been underdogs, and we know that we're just a very small drop in the bucket in the whole system, proportionally. But we make a huge difference to many, many people. And just like the free clinic, people told me that I would be dead if this place didn't exist, And I had people so grateful to me. And Medicare, when we went before Congress, it was basically like throwing us a bone to have us included, saying that we will pay for, an adjustment of the spine. And typically it's 12 visits a year. And I'm not sure what, and different providers who were paying maybe, $20, or something per visit most of the time. But the fact that it requires people to have a lot of documentation to show what's called the subluxation, the bone out of place in the spine, which requires an examination. Medicare does not pay for any diagnostic services at all. No x-rays, no diagnostic tests, no examinations, though it's required to document things in detail to be able to get paid for the adjustment. We're not paid for any physical therapy modalities at all under Medicare. We're not paid for adjusting any extremities. So if your hip is out of alignment and that's causing your back to be out of alignment, sorry, we can't pay for that. Too. And again, these are things that, that is part of our scope of practice, even in New York State. And, it's been a real uphill battle over years, just even trying to maintain the little bone and other cuts to Medicare when I was in Virginia that were on the table for the little bit that they did pay. So
do you think it would help at least to have, if there's just single payer, to not have to be dealing with all the different insurances and all the different kind of requirements and what they do and don't pay for each one? Would that help reduce some of the costs of being able to accept insurance?
Well, it would certainly greatly reduce the complexity, absolutely. And, by simplifying the process, and because insurance companies saying, well, it's up to you to keep track of all the changes and reading all their monthly manuals and all this stuff is, impossible unless you have, again, a team of people in a hospital setting. So it's ridiculous. So again, it would simplify matters, but if it's going to be held to the same standard of what Medicare is, which is such a low substandard, of services. Really, in today's world, it's not going to really provide effective chiropractic care. I had so many peers say, in going back to the early days of chiropractic care, we were able to create so many more miracles by, rapid adjustments of the spine. And it's not possible today because of so many factors that are stressing people's nervous system. When people are continually in a fight, flight, or freeze, now there's a fawn, another one too. Stress with their sympathetic nervous system is in arousal, and their body is flooded with cortisol and stress hormones, and that's ruining their endocrine system and adrenals, and that's pulling minerals, for example, out of their joints to try to feed the stress hormones. Patients can't hold adjustments. So the nutritional part is of their food source, and is basically compared to the days before when everyone was eating organic, the toxicity from our commercial food system now is creating such ill health. So chiropractors are trying to be at the forefront and helping people prevent, working with also chronic diseases and neurological systems, and help reduce in things like dementia and other chronic illnesses that are pandemic right now. And for myself, I now take often my visits, if I was
You cut out for just a second, but I'm going to
reverse and stay ahead
this opportunity to ask Dr. Soboroff, and not to put you on the spot, because this might not be an aspect that you've looked at, but do you know offhand whether the New York Health Act will be able to do a little more than Medicare does in terms of covering chiropractic and some of the alternative and complementary modalities to healing?
Yeah, I don't know for sure. And I don't think it's been addressed directly. What would probably happen is once it passes, in the implementation of it, then people like you, Dr. Katz, hopefully would be heard, and there would be more room made for chiropractic reimbursement and treatment. But that's something that could very well be addressed in the implementation of the law. And certainly the rates would be fair and probably above what Medicare now pays. And certainly, as a society, we need to take a look at all the alternative and complementary treatments, see what place they have along with Western medicine, and try to incorporate them. But right now, there's nothing specific.
So that's an area where we can certainly go and should go to work, because one of the things, most of us understand that there's such a need for complementary preventative care and alternative care that can boost up our immune system, so that it's not just sick care but also health care, and we need that to be part of this conversation. And I'm so thankful for you pointing out some of the challenges, and I think it's really an opportunity for us to incorporate that. What I loved about the free clinic, many things, including that I could go there, but was that there's so many different, there is complementary medicine there. You can get your traditional medicine and your complementary medicine, and there's really a lot that can be done to help you move forward with health challenges. So.
And we even have monthly chronic care meetings where nurse practitioners, acupuncturists, herbalists, myself and others, we discuss difficult cases together.
Wow.
To see how to best help the patient.
Can you imagine if we could do that in a greater way? It would be just amazing. So I have a question here that I will admit I do not know the answer to, but I don't know if anyone here would know the answer to. It is about Governor Cuomo's executive order about insurance companies paying for telehealth treatments. And the order is that they must pay for telehealth and that insurance companies cannot charge co-pays, deductibles, or co-insurance related to telehealth. Does anybody here have any information about whether the insurance companies are cheating on this executive order? It may be too specific for this particular panel, but do any of you have insight into that? I am sorry, we can't answer that question right now, but I think it is a good one. I mean, in general, we know that insurance companies try to get out of paying anything that they can pay. Like, you know, I'm sure most of us have spent hours with insurance bills, like trying to figure out why they're not crediting deductibles or why they're not, you know, covering a service that needs to be covered. And I think the more you need to deal with that, the more it becomes, it can really take up all your time, especially as if you have more health challenges. So I wouldn't be surprised to hear that there are issues getting the reimbursement for that, but I think it is something we should look into.
But it is another good reason to simplify the reimbursement and the delivery of healthcare, so that whoever is covering the service is accountable to the consumers.
There's another question in here that I think is a good question as a union organ. So the question is, unions are saying they don't want to lose healthcare benefits as their major bargaining chip. And I mean, when I was union organizing, it would be something we would be able to talk about door to door. Let's form a union. You'll be able to negotiate better rates on your healthcare. You'll be able to, have power to actually do something. And it's absolutely true. Before other people chime in, I will briefly say, though, imagine if we can negotiate better rates on our healthcare just being a smaller union, what we can negotiate really as a state, how we can drive the costs down and really negotiate. And I don't mean like nickel and dime you so that you're only getting $20 for an adjustment, but some of the glut in this system is extreme, and we do need to kind of hold the system more accountable. So I think there could be room there, certainly with the pharmaceutical companies. And does anyone else have thoughts?
If I could speak to that, I think that one of the greatest troubles of American unions since the 70s has been what you could call the shift to the business union model, where unions have been on this steady decline of their point of rank and file strength and lifting all boats in the society to one where many unions see themselves as purveyors of services, kind of like an insurance company. And so the power has shifted from a direct worker power model to one of representational power. And we are so fortunate to have someone in our town, Ellen David Friedman, who's a national and international labor leader, who's one of her main goals is building rank and file activism within existing unions. And I would say the comment there about health insurance as a bargaining chip in unions, it's almost irrelevant to me as an organizer, because if unions don't reclaim our history of rank and file activism, all will be lost. We're at a crossroads here where the neoliberal agenda continues to march on around concentrating wealth in the hands of fewer and fewer people and extracting more and more of the public good, whether it's from education or healthcare or other areas of society. And really, my perspective is the only thing that's going to stop that is an increased democratization of the workplace. And certainly, as Mirabel said earlier, and I made a note there when she said it, that the New York Health Act would have a profound effect upon democratizing our society. And it's easy to see the ramifications of how harder how much harder it would be for workers to be exploited if they didn't have to stay in a job so that their chronically ill child needed health insurance, or their spouse needed insurance, or whatever. But I really don't care about the issue of unions and health insurance, because everyone needs health insurance, and unions, including mine, need to get it together and build worker power. That's the bottom line.
Amen.
And
Plus, I
that's
will
it.
say there are a lot of
That's-
other issues that are affecting workers that can be organized around.
Yes.
But Maribel, yeah. Sorry, did you have
Well, one thing is, like, it's people like me, rank and file workers, that are going to hold people like you, hold your feet to the fire when you get elected. So we're going to be like, you're not going to forget why we elected you, right? And this is what we need you to do. And we're going to be the people helping you get elected, and we're going to be the people making sure you don't forget your roots.
All right, that's the way to go. Maribel, what did you had your hand up, so I wanted to. Uh-oh, you're muted. Still muted. Oh, there.
That having the I've heard the other side of this argument, which is that having the guaranteed healthcare for workers, making that a constant thing that workers have regardless, then allows them to focus on other super important, issues like a living wage, like sick leave, et cetera, et cetera. So I've heard the argument that actually it will take off such a burden from workers in terms of their ability to focus on other things, so that, they can continue to improve their quality of life. And the other thing I was going to mention is that I think the other reason why I think supporting universal programs in general, but for healthcare, is that because it creates broad-based constituencies that support it, and it also impacts a broader base of society, I think they stand stronger against time and against any conservative efforts to dissolve them, because they have such broad-based support, versus what I consider, in my opinion, my humble opinion, to be kind of neoliberal, compartmentalized, divisive, identitarian demands that actually, as soon as the donor class forgets about them, get dissolved. And I think so that's what I think politically. I think that's another benefit of supporting single payer healthcare. If you look at what happened in France with Macron with pensions, like no way, no how were they able to take away those pensions, because it had such broad-based support that people just went out there and protected it. And so I think we need to get healthcare to that place. The same way nobody's talking, even when there's talks about Social Security, from across all social, social levels of our society, there's like opposition, right? And it's really hard to really dissolve it. And I think it's time to get healthcare to that place where it's untouchable.
Right. And I'll just weigh in, with one more thing, because unions are really important to me as an organizer. But I will say that the number one issue that I really saw resonate in every union campaign that I led across this state, over and over and over again, across all demographics, everybody, what they wanted at their jobs was respect. And they wanted a seat at the table and a voice and respect.
Dignity.
And that, healthcare was a great idea also, is a great benefit, and increased wages is a benefit. But also I saw, and I do hear from workers today, like luckily it sounds like it's not affecting the public workers as much, but many, many union members who are really intimately involved in the budget process have to, have this concern that their raises are primarily going to the increasing premiums every year, because the healthcare companies are just increasing. And many workers in general who aren't in unions are finding our wages have stayed stagnant since the 70s, because our employers are just paying so much more each year just to provide coverage, and we're getting so much less each year for that coverage, that I really think that the ancillary, we already know that they're financially, this actually is going to work out pretty well for the majority of us who aren't super rich, but passing the New York Health Act. But there might even be financial benefits beyond that. We might start to see real raises. We might start to see, real savings on our property taxes and our school taxes. And I mean, there's so many sectors that are affected by this. But anyway, not to go on my soapbox, this is about what you guys have to say. Dr. Soboroff, I have a question for you. Oh, wait, really quick. I have a response to the telehealth thing. One of our, and you can look in the chat for more if you want to follow up, but it says, yes, some private health insurers seem to be neglecting to waive co-payments for telehealth. I have had to follow up sometimes with them and pursue that. So there is somebody right here in our group who has already had to deal with that issue. And it is just another example. I'm very excited about this. These people that are going to be helping navigate the healthcare system. That's part of the New York Health Act. Forget the name for it. But Dr. Soboroff, we do have
coordinators.
Yes, care coordinators. Can you talk a little bit about the racial implications of single payer versus our current healthcare system? There's a question from the.
Okay. Well, one thing that I've learned recently is that the reason, just to step back a little bit, is that the reason, one of the main reasons we don't have a universal system is because of race, and because of pushback against desegregating the healthcare system. If we had a universal payer like Medicare. So it could have happened in the 40s, in the 50s, even in the 60s, that there was an opportunity for universal healthcare. And what we got was Medicare for older people and Medicaid for the poorest people, but not a universal system. So there's systemic racism has just pervaded the medical system like every other one. Certainly, we've known for a long time that people of color have had lower life expectancies. Their healthcare outcomes are poorer, lower life expectancies, higher maternal mortalities, lots more chronic illness like high blood pressure and diabetes, and climate-caused illness like asthma because of where they live. So there's no question but that there's been systemic racism throughout the system. I also learned recently in New York, in some of the New York hospitals, that people are segregated, patients are segregated based on their insurance. Like in Brooklyn, people with private insurance are, upstairs, and they tend to be mostly white people. People with Medicaid are in the basement and have poor conditions for delivery of care, and they tend to be Black and brown people. So there's lots of information about how systemic racism is still with us. And, certainly in other ways that affect health, like food insecurity, poverty, lack of insurance, of course, and mass incarceration. I mean, all those things affect people's health in the big picture. And certainly there's lots more disparity in all those areas. So we need to do our best to undo that. The way a public system that's universal would take the first steps anyway in making sure that access is available for everybody. in systems where everybody does have access now, like our VA system, which is really a socialized medicine system because the government owns the hospitals and pays all the and employs the providers. But in that system where everybody has equal access, many of the healthcare outcomes like chronic illness is equalized. Those disparities go away in that system. So when people are in the military, they have less problems with health conditions.
Maribel, I saw you raise a hand. What did you want to add to that?
Yeah, I just wanted to build on what Susan was saying, and I feel that one of the things that does happen in this country is that it's been very effective at blaming the poor, and it's ingrained in our culture, you know, and that's connected to my previous point about how bad a job we've done as a country in terms of providing social protections for all, and the response is blaming and punitiveness, right? And I think that to Susan's point, I do think it's important to I'm very committed to framing these programs as a collective human right, because I think what happens is that people get muddled in the poor blaming and the racist blaming. And so as soon as we have, again, an identitarian program, then other groups are like, well, that's for them. What does that have to do with me? Why am I spending my tax dollars on that? How does that directly benefit me? And it becomes this destructive, divisive thing that ends up impeding, right, any real progress on collective programs. And so this is why I am very committed to a cross-racial movement around the New York Health Act, and we need to frame it as a human right, as a collective right that everybody has a right to. I mean, we are so divided geographically. You know, I'm from New York City, and when I got here, you know, I realized it was like an aha moment. Wow, there's such an urban-rural divide, you know, between people in this country, where people are not aware of white poverty, and of course our country is fixated on black-white divides, right? So and it obfuscates like the problem across racial groups, across, you know, different demographics in the country. And I think we need to build cross-racial support around these initiatives, because otherwise, you know, we're gonna go into that downward spiral of divisiveness that doesn't allow these programs to be implemented, which will disproportionately benefit, poor, working, and marginalized communities, disproportionately Black and Brown.
I would weigh in on this too, because I've really gotten to experience a lot of different kinds of healthcare. There have been years of my life when I haven't been able to afford any healthcare. There's been years of my life when I've been on Medicaid. There's been years of my life when I've had, blue chip private insurance. And I will say that the difference is also pretty extreme in how you're treated when you have different kinds of insurance. So for example, I grew up having Medicaid a lot of time, and I was younger then, so it's not as easy to explain the differences there. But when I had my first child, we had health complications, with my child and with me, and my husband had to stay home and care for us. And so we were really broke. And I was here, I had just been a lawyer at a really fancy law firm, but there we were totally broke and having to get Medicaid. And the way that I was treated then versus a few years later, same person, same child, but better insurance, same providers, even. It's unconscious. It's nobody did it maliciously. But when it was Medicaid, the questions were, my health concerns weren't really taken seriously. This wasn't followed up on, that wasn't. And when I had my own insurance, it was a much different level of care. So I don't think it's intentional, but I mean, part of the problem is that there are far fewer providers you can go to when you have Medicaid. And part of the problem is there's unconscious biases that come out in your care. And people of color have been saying this for years. And I've certainly seen that, and poor people have been saying it for years, that you just don't get the same level of care. And this will eliminate a lot of those problems because we'll all have the same care and we'll be all people walking in to get our health care. And also it'll help, I think, us all collectively make sure that the way that we're paying providers and the payouts are fair, because everybody will have a stake in making sure that providers are still there to care for them and that everybody can take this insurance. And, you know, it'll change the playing field so dramatically, I think. Does anybody, and then somebody left a comment that Medicaid is fantastic. And I mean, it's true, it is full coverage. That is the nice thing about it. You're not paying a ton of money on top of it. But does anybody else have any questions that's on? Thank you all so much for joining us in this conversation. You know, all the people that have taken time out of your busy evenings to come watch this conversation, all of you panelists who are taking your time to educate us and talk to us about this subject. Looking at the chat to see if there are more questions. Okay, so can someone deal with the dreaded word socialism as we speak of advocate for single payer?
Can I make a quick comment on that? My stepfather was a captain in the U.S. Navy. And, you know, I have lots of conversations at the bedside with, I would say, more rural, conservative Caucasians sometimes from Central New York. And I always bring up the question, did you serve in the military, or did someone in your life serve in the military? Because the healthcare provided in the U.S. military is one of the most successful experiments in socialized medicine in this country. And we reference the VA system here too. So there's different ways of approaching it, but that's a point of conversation that I found constructive and less divisive as a way to get into that conversation.
Sounds like a good response. Maribel?
I was asking Michael if he meant, if his question was strategically speaking how we deal with the word socialism. Like, is he concerned that supporting single payer healthcare will lead to accusations of like communism or bread baiting? Is that the concern? Well, so I don't know, but I'm gonna just say that you know, this is just obviously my opinion. That's all it is, my humble opinion. But I think that in this country, there's been an erasure of the influence of socialists and social democrats that have really pushed a progressive agenda in this country historically, from our 8-hour workday. And I think that there's an intentional kind of omission of that history. And I also think there's also a not so helpful conflation of all the strands of socialism. And I think Bernie Sanders was very wise in choosing, strategically speaking, in terms of choosing social democracy as the path that, when he said I'm a socialist, you know, he was really a New Dealer and bordering on a social democrat, and would point to countries that have social democracy, like European countries. So I think we need to kind of shut down this red baiting immediately. Like it is unconscionable that we can be our own worst enemies in terms of opposing the programs that other countries that are less wealthy than us are enjoying. Like who would, only our worst enemies would want Americans to have worse quality of life than their global counterparts. And so I think the red baiting is a strategy to shut down dialogue. And I think we need to nip it in the bud immediately and deflect right into, you know, where we are as a country in terms of unprecedented quality, in terms of like outcomes around various social indices. And I don't think we should allow ourselves to be derailed. That's just my humble opinion. I think that this country has done enough of that. And it's very unfortunate, and it's been to the demise of, you know, poor working and middle class citizens of this country. And I don't think we should allow it, personally. I hope that answers the question, but I'm not sure what the angle was to the question.
Well, I have another question here, and I hope I'm doing it justice. Does universal health care run largely by nurses, majority women, mean caregivers will have more time to replenish? And Serinda, if I'm getting that wrong, because I'm not entirely sure I understand what it means. So if you want to jump in, or Stephen, if you want to unmute Serinda so that you can ask in your own words, that would be great. It could also be because I don't know.
Can I take a little stab at that one too?
Sure, please go for it.
Back in November, I joined Ellen David Friedman on a 2-week trip to Sweden and Norway, where she had been invited to go and lead union organizing, speak with different workers across those 2 countries. And we actually met with a lot of nurses and physicians in both of those countries. And something that I did not expect, because I think for years we've held up Sweden as this kind of light on the hill of enlightened social democracy that everyone assumes has socialized healthcare, right? That the neoliberal agenda has steamrolled Sweden and to a lesser extent Norway just as badly, if not worse, than the United States. And I think this is just me editorializing. I think worse because they didn't see it coming. They didn't expect it. And so just the fact of having, if we accomplish the New York Health Act, if we get universal health coverage, we can count on the fight continuing, that the forces in our society which seek to harvest more and more of the social good and give it to fewer and fewer people are not going to roll over and go away. And I think that just one example, in Sweden, where 70% of the country is unionized, right? Each nurse negotiates his or her own contract, right? I mean, it would take a long conversation to explain this to you, because I had to have 20 conversations. I kept asking, are you serious? Is that really the way that works? But it does not necessarily result in nurses having more time to chill and rejuvenate, because also in Sweden, nurses are not assigned to, it's like I signed up for night shift, I'm working night shift for the next 6 months, which I get to do as a union member here in the US. In Sweden, you could actually be called from your vacation in the Greek islands to come work a shift within 24 hours. And I said, is that real? They're like, yeah, they'll pay for the ticket and say, you have to come back from vacation to work a shift. So universal healthcare is not a panacea. It is a huge step in the right direction. But we will have to continue to be vigilant. So that's a take from Scandinavia that we hold up as for good reason, as a light on the hill around healthcare and education.
So it sounds like we really need to use this momentum as we organize to get this act passed to build a strong enough grassroots movement that we can stay vigilant and that we can keep making sure to do better, to include more coverage for chiropractic and acupuncture, and to do more to make sure that our nurses and our doctors are being treated fairly and stay and are able to keep caring for us. And I'm excited about that. I think building this movement will have us get the people together so that we can keep it accountable, and keeping that message at the forefront that we have to keep doing better, and it's not over just once we pass it. So there are some resources that Maribel has shared in the chat, and that we will try to also share on our Facebook page when this has been recorded, and will be publicly available. So I'll try to pull this off the chat so that we can share it. Maribel, do you want to talk about what those resources are?
I mentioned the NewYorkHealthCampaign.org, which Susan referred me to in our planning meeting, and I noticed it's a great resource. So people should check that out. But then there's also a tool that can help like if you organize a group to generate emails and tweets at legislators. So like if you want to know what kind of phrases or things to say, people can like do it collectively and send it out at the same time. So that's a toolkit for that. And then the second one is sharing your personal story. And I think that's something that a lot of the folks in the campaign are regularly sharing out, stories that people can see and just in our radar all the time, like this is an issue. And then I think the last one is there's also, I think you're able to share any COVID stories you might want to share. And then the last one is a document that kind of looks at what are some of the main issues that resulted from the pandemic in terms of healthcare, and how would that have been different had we had single payer health, the New York Health Act. And I do want to acknowledge what Scott said, which is that it's not a panacea, right? Like even with universal healthcare, there's like infrastructural issues that would have to be addressed. There's other factors, but yes, it certainly is a worthwhile program for us to pursue collectively. And I have my sign. Sorry. We want it now. What's your
Serinda or Stephen, could you help me try to unmute Serinda? I'm trying to unmute you so that you can also talk. Serinda is a nurse as well, and I'm sure has more to add to her question because I probably just got it a little bit wrong.
Give me just one sec.
Sure. But yeah, it's going to take all of us. We got to be out there. We got to be active, and we can do it. We're really close. Okay, looks like you're unmuted.
Yes. Hi. Yeah, thanks. I'm really enjoying hearing the experience people have around like the potentials of universal healthcare and their possible, downsides, and how we could think about those ahead of time and kind of, perfect some of the kinks out of it. And I'm not sure how to do that or what all the resources are, but I'm feeling really supported by the resources here tonight. I appreciate it so much. And I'm also thinking about harm reduction and what universal healthcare means for harm reduction. And as one of my hats as a nurse is in harm reduction. And I feel pretty dedicated to making sure that people get access to safe injection sites and to clean needles and safe people to, sorry, I'm walking and it's on the street, safe people to receive healthcare from that are respectful of people who use drugs. Like that takes a lot of resources, and we don't have them right now. And I think that would go a long way towards creating a more liberated society as a whole, because I think I spoke to this once before, but people use drugs to support themselves. It's a medicine. You know, they're self-medicating. We can trust them. If we want people to not feel like they need to be medicated so much, if we want to help people feel better, we need to create a different world, but we don't just tell them to stop. We create a different world, and we make a different world that inspires people and has the resources to support people to come into their freedom and do the healing they need to do. And it could mean they continue to use drugs, and that's okay. So that's where I'm coming from as a nurse. And I guess I wonder, like, if there's money. I haven't studied other universal healthcare systems for harm reduction. I just not really like a studier like that. So if anybody can speak to that, I would love to hear. Thanks.
Thank you for sharing. It's so, the work that you guys are doing is really important. I think I shared with the panel the other day that I heard of somebody coming, somebody I know who comes from Massachusetts to the clinic here in Ithaca, because it is the only place he can find that that really is able to treat people struggling with addiction with dignity and meet them where they are. So, but yeah, what can we do with harm reduction, and how will our insurance change whether we're able to focus on harm reduction more?
Oh, well, certainly addiction medicine in general is a specific service that the New York Health Act will pay for, will cover. I don't know, that's sort of a delivery issue in that specifically about harm reduction. I don't know what the answer is. Again, in the implementation of the law, of the bill, hopefully there would be room for that. There would be grants for that. There would be provision for that. But I don't know specifically.
Well, one thing right off the top is that people will have insurance, so that they will be able to be cared for, whether they've gone through the hoops of getting insurance coverage one way or another. So that's going to be great. We are actually coming to the end of our forum today. So I just wanted to take another moment to thank you all for coming. It really is great to be able to have a focused conversation about this issue. And I hope we keep talking about it. I know people are talking about it. We all have to talk about it, act on it, and be out there. I was talking with Mary Garish yesterday, and a big part of how she's been able to achieve some of the incredible things that she has helped make happen, even is being out there. She was getting arrested for healthcare. She was a lawyer getting arrested for healthcare, and the Affordable Care Act wasn't her first choice, but it was a stepping stone. Her arrests actually swayed several people who weren't going to vote for it, and helped make sure that we got that. And she was able to work, with activists in Vermont to pass this legislation, and it didn't go as far as we needed it to there. So it wasn't able to ultimately survive because they didn't do the progressive income tax, which is the key part of making this financially work. But her advice to us, because she couldn't be here today, was we've got to be out there. We have to be out there showing that it's important with our bodies out in the streets, demanding that we get it, and we'll get it. So I'm excited to get this process going very soon. We need it. We're in a crisis. And let's take this worry off of our plates so that we can really deal with all of the other things that we need to do to fix the problems that are at a point where we can't ignore them anymore. So thank you all for coming. Have a wonderful night. And I will see you out there in the streets. Okay, bye.
Bye.